and that gave me an opportunity to make several visits to several medical institutions, Madam Speaker. And I remember there's a time that we visited GOTRH in Kisumu County, and when we were dealing, or when we wanted to establish the challenges that they were facing, Madam Speaker, one of the challenges was that they were having a spillover of patients from neighboring counties. That is Vihiga County, sometimes even Kakamega County, Madam Speaker, even Kisii County and Nyamira sometimes, Madam Speaker. And the challenge that they had, according to them, was that the Miaga County resources sent to this particular county were actually being expended on mostly patients that did not originate from the same county, Madam Speaker. And when I heard that GOTRH had finally been taken over by government, Madam Speaker, I knew that it was a relief to that county because most of the resources were going to people from other counties, Madam Speaker. And so I support this motion because it will, of course, sort out counties so that counties may be able to improve on their other facilities other than that particular facility that could be attending even patients from many other counties that are neighboring this county, Madam Speaker. And so with the establishment of teaching and referral hospitals in these recommended regions and other regions, especially the central region where some of us come from, Madam Speaker, this will be a good and a progressive step. And so I support this motion, Madam Speaker. The other thing, or the reason for my support for this motion is the fact that these hospitals also serve as teaching centers for upcoming doctors, pharmacists, and the like, Madam Speaker. And it is important to remember that most of the counties now have an established university within the counties. And when we need, because we need to establish many schools of health sciences in these universities, they need these kind of hospitals so that the students could be able or can be able to learn and practice their profession. And so this is a very progressive motion that should be supported by all because we need to establish hospitals that can also be able to train our young doctors, Honorable Speaker. We also note that a lot of funds are left at the Ministry of Health headquarters. Although health is devolved, not all or the whole budgetary allocation to the Ministry of Health goes to counties. So there is still a lot of money left at the Ministry of Health headquarters, Madam Speaker. And counties should be able to benefit from this particular amount that is left at the headquarters. And the only way, or one of the ways of counties benefiting would then be to have the national government, through the funds left at the center, establish these referral hospitals in these regions, equip them, engage professionals in those particular hospitals so that the cake that is left at the national government, at the Ministry of Health headquarters, may also benefit counties in one way or the other. And this would be a good way of benefiting counties through establishment of these referral hospitals in this region, Madam Speaker. We will not forget, Madam Speaker, to say that with all this, we will want governors to also better the other health facilities so that once these national, teaching and referral hospitals have been established, that governors now will concentrate on those other smaller facilities, Madam Speaker, that serve members of their counties. And so governors will not now have an excuse of telling us the kind of story that we had from GOTRH, that, see, we are spending a lot of money on this particular facility while this facility is serving other counties. that do not chip in anything, despite the fact that members or constituents from their counties are coming for services here. So these will help governors to concentrate, Madam Speaker, on those other small facilities that will serve the people, even at the divisional level or at the sub-county level. And so this is a motion that we need to support. The other thing is that mostly when we have these teaching and referral hospitals, government, the national government invests in specialized equipment and specialized health staff, Madam Speaker. And so when this comes, it will benefit those that may not be able to travel the long distances to the only 3 referral hospitals that we have in the country. And we will have people then benefit health-wise from these referral hospitals that will be so established, Madam Speaker. And so for these and many other reasons, Madam Speaker, I support this motion to have these referral hospitals established in these regions and also other regions in this country, Madam Speaker.